Why do thoracic spine injuries and thoracic spine conditions seem so much less common than cervical spine, the neck, or lumbar spine, the lower back injuries? I discussed that question and how it affects military veterans in this video. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help veterans by writing Nexus letters that argue your orthopedic injuries are connected to your military training and service so you can get the compensation you deserve. Now, I got this comment on one of my videos on the Veteran Nexus Letter channel from Ed Sauer 4702. He commented just recently, I have lumbar spine problems as well as cervical spine problems. I told you, I'm told you don't notice thoracic problems as much because of a lack of motion in that area. And he's absolutely right. With the neck and the lower back, there's a tremendous amount of motion in the neck, especially bending forward and back, as well as rotating, as well as tilting. In the lumbar spine, again, tremendous amount of flexion extension, and to a lesser extent, side-to-side bending, but again, lots of side-to-side motion. So there's tremendous motion. Cervical spine, lumbar spine, much, much less motion in the thoracic spine, largely related to sort of being the intervening stabilizing segment and as in motion of the rib cage. So typically when you see thoracic spine problems, it's either some mild degenerative changes, more secondary to the lumbar spine, and maybe at the very upper part of the thoracic as secondary to the cervical spine, but typically not that much. It can be a traumatic event. You can have a thoracic spine fracture related to a traumatic injury. Occasionally you will see thoracic herniated discs or things like that. Typically not so much a problem because that usually doesn't cause a ton of symptoms. So thoracic spine, a lot of times not a huge source of problems, but as far as disability claims go, you just don't see it that much either. Also, very important to note, especially when it comes to DBQ exams, the VA lumps thoracic and lumbar spine together into the thoracolumbar spine. So maybe there's a way, it would be hard, I would expect though, to get a separate rating for thoracic spine and lumbar spine without some specific circumstances for what that's worth. But it is much less common, certainly a ton less common than lumbar spine or cervical spine. Now, if you're learning more or interested in learning more about the disability claims process, you can get a free copy of my ebook, The 8 Most Common Reasons the VA Denies Service Connection for Disability Claims and How You Can Beat Them. There's a link in the description below this video. Just click that link. You can basically get it free, name, email, address. It comes right to you. Make sure to subscribe to this channel. Click the bell to be notified when I release a new video and when I start my Veteran Nexus Letter live shows. It's new, so I got the title wrong. Now, if you're interested in a Nexus letter for your injury or condition, click that link in the description below. Scroll down. You can learn more about working with me and working with my team. We do everything we can to make the process quick, to make it simple, and I try really hard to write a Nexus letter that gives you the best chance of success in your claim. Thanks for watching, and I look forward to helping you.